Welcome to the Week 5 education presentation on depression. We'll cover what depression is, how to recognize it, and how it impacts men and women. Most people feel sad or low at some point in their lives. They may feel blue for a couple of days or just be in a funk. But clinical depression, also referred to as major depression, is defined as having a depressed mood for most of the day, particularly in the morning, and a loss of interest in normal activities and relationship that have been present every day for at least 2 weeks. In 2015, an estimated 16.1 million adults aged 18 or older in the United States had at least one major depressive episode in the past year. This number represents about 6.7% of all U.S. adults. Major depression is also more common in women, at about 8.5% of the population versus men at 4.7%. Women have nearly twice the rate of major depression due to biological reasons, such as hormonal changes during puberty, menstruation, pregnancy, miscarriage, and menopause. Other factors that boost a woman's risk of depression are increased stress at home or at work, balancing family life with a career, and caring for an aging parent. Raising a child alone can also increase the risk. Depression in men is significantly underreported. Men who suffer from major depression are less likely to seek help or even talk about it. Major depression also seems to be more prevalent in people 18 to 25 years of age at 10.3% of the population versus people 26 to 49 at 7.5% versus those older than 50 at 4.8%. Some common triggers or causes of major depression include the loss of a loved one through death, divorce, or separation, social isolation or feelings of being deprived, major life changes like moving, graduation, job change, or retirement, personal conflicts in relationships either with a significant other or a superior, and physical, sexual, or emotional abuse. Major depression in men and women can manifest itself in different ways in different people. While the symptoms used to diagnose depression are the same regardless of gender, often the chief complaint can be different amongst men and women. Here are 12 signs of depression in men. Fatigue. Men are more likely than women to report fatigue or other physical symptoms as a chief complaint. Sleep problems, such as insomnia, waking up very early in the morning, or excessive sleep, are common depression symptoms. Like fatigue, trouble sleeping is one of the main symptoms that a man might discuss with their doctor. Health problems like constipation or diarrhea, as well as headaches or back pain, are common in people who are depressed, but often men don't realize that chronic pain or digestive disorders go hand in hand with depression. Instead of seeming down, men who are depressed often show signs of irritability. Men report feeling irritable because they are having negative thoughts constantly. Major depression can slow down a man's ability to process information, thereby impairing his concentration on work and other tasks. Some men manifest depression by being hostile, angry, or aggressive. A man who realizes something is wrong may need to compensate by demonstrating that he is still strong and in control. Men might be more likely to report symptoms of depression as stress. It's not that they have more stress, it's just that it's more socially acceptable to report it that way. Research shows a strong link between anxiety disorders and depression. Although women report nearly twice as much anxiety as men often find it easier to talk about feeling anxious rather than sadness. Alcohol and drug abuse frequently accompany depression. Research shows that alcoholics are almost twice as likely to suffer from major depression as people without a drinking problem. Depression is a common reason for loss of desire and erectile dysfunction, and is one of the symptoms men are not inclined to report. Performance problems can come from depression and can make depression worse. Although women are more likely to attempt suicide, men are more than 4 times more likely to die if they do attempt suicide. One reason is that for some women, attempting suicide is more like a cry for help, where for men, their intent is more permanent and tend to choose more lethal methods. Older men are at higher risk for suicide, and doctors may miss depression symptoms in this group. More than 70% of older suicide victims saw their primary care physician within 1 month of their death. Factors that increase the risk of depression in women include reproductive, genetic, and biological factors, interpersonal factors, and certain psychological and personality characteristics. In addition, women juggling work with raising children and women who are single parents suffer more stress that may trigger more symptoms of depression. Other factors that could increase risk include a family history of mood disorders in early reproductive years, loss of a parent before the age of 10, loss of social support system or the threat of such a loss, Ongoing psychological and social stress, such as a loss of a job, relationship stress, separation, or divorce. Physical or sexual abuse as a child. Use of certain infertility treatments. Use of certain oral contraceptives. Here are some of the differences between male and female depression. Take a moment to review, and pause this video if necessary. Medication and psychotherapy are effective means to treat depression. Your primary care doctor or psychiatrist can prescribe medication to relieve symptoms. People may also benefit from seeing a psychiatrist, psychologist, or other mental health professional. Depression, generally, is not a disorder that you can treat on your own, but in addition to professional treatment, these self-care steps can help. Stick to your treatment plan. Don't skip psychotherapy sessions and appointments. Even if you're feeling well, don't skip your medication. If you stop, depression symptoms may come back, and you could also experience withdrawal-like symptoms. Learn about depression. Education about your condition can empower you and motivate you to stick with your treatment plan. Encourage your family to learn about depression to help them understand and support you. Pay attention to warning signs. Work with your doctor or therapist to learn what might trigger your depression symptoms. Make a plan so that you know what to do if your symptoms get worse. Avoid alcohol and recreational drugs. It may seem like alcohol and drugs lessen the depression symptoms, but in the long run, they generally worsen the symptoms and make depression even harder to treat. Take care of yourself. Eat healthy, be physically active, and get plenty of sleep. Consider walking, jogging, swimming, gardening, or another activity that you enjoy. Sleeping well is both important for your physical and mental well-being.